Cognitive behavioral therapy for insomnia is a super effective program for eliminating insomnia without medication. Many patients think that insomnia can only be treated with medication. Moreover, doctors mainly prescribe only medication. Watch this video to the end and you will understand why chronic insomnia develops, how to deal with it, and that it, generally speaking, is not a sentence. Most insomniacs can be cured, I emphasize again, without prescribing pills. Well, I'll start perhaps with the fact that for the first 15 years of my practice, I also mainly treated insomnia with pills. And unfortunately, I realized that I was practically not curing anyone. I prescribed medications, tried to cancel them after some time, but faced withdrawal symptoms, dependency, and increased dosages. It was a never-ending, utterly pointless process. Moreover, the patients themselves, seeing that the effectiveness might be suffering, went to other doctors who prescribed different medications, neurologists, psychiatrists. And it was such a vicious circle, if I may say so, going to doctors, using various medications which worked at some stage, then stopped working. And all in all, this years-long process of fighting insomnia was absolutely unsuccessful. I still remember Einstein saying, "Who said that the greatest folly is to do the same thing but hope for a different result?" So here's what's happening now, guys. A patient comes to the doctor and says, "Doctor, I've been treating insomnia for 15 years. I've taken 20 different medications." He asks me, says, "Doctor, as the beacon of national sleep medicine, you'll surely find the 21st cure for me." And now I understand that there is no such medication. That is, they are against prescribing medications in certain situations. But in most cases, most insomniacs can be effectively treated without drugs. And I will tell you about it today. And if you yourself suffer from insomnia and have already tried various medications that didn't help, give this video a like. So, let's figure out why sleeping pills don't help. Or antidepressants, tranquilizers, neuroleptics. Firstly, there are insomniacs who have an obvious reason, and it's not related to their psyche at all. Well, for example, iron deficiency, vitamin D deficiency, increased thyroid function, restless leg syndrome, sleep apnea. In this sense, a thorough examination is needed to rule out any possible causes of insomnia and accordingly confirm them, get treatment, if the insomnia itself will pass. And in this situation, if you have some other obvious reason, and you just give a sleeping pill which symptomatically causes sleep, then you took the drug, but the reason remained and the insomnia returned, and you will not get any long-term effect. The second problem is that even we can examine the patient. I'm setting up a sleep medicine center where we conduct classic polysomnography and various analyses. And here we see that there are no obvious organic psychological reasons, but insomnia is present. And earlier, when I didn't have the proper information, well, I must admit that medicine is also a developing field, I understood, or how I was taught to prescribe drugs, that most likely this is some hidden pathology, psychopathology, and it is necessary to prescribe the corresponding psychoactive drugs. But at the same time, prescribing them, I also understood that I couldn't cure the person. It turned out that insomnia, and more than half of chronic insomnias, are so-called conditional reflex insomnias. Or it's the so-called Pavlovian model of insomnia development. I literally explain it's said on the fingers. If a person experiences some kind of stressful situation that really disrupts sleep, and it usually lasts more than a month or more than 3, then the person starts having problems with sleep and the person starts trying. After attempting to sleep 20-30 times without success, a person develops a strong fear reflex of insomnia. Then the person lies in bed and he develops the following conditioned reflex bed insomnia. Here is a healthy person. If you put him in bed, he thinks, "Oh, my dear bed pillow, in about 15 minutes he will doze off and fall asleep." If someone develops a fear reflex of insomnia, they can desperately need sleep, dozing off in chairs or while standing in the metro. However, once they get home and think, "I won't sleep now," it triggers their fear reflex of insomnia and they cannot sleep. That is, by trying to fall asleep, a person further exacerbates or intensifies insomnia, forming a conditioned reflex of fear of not sleeping and bed insomnia. Then the person begins to focus on this problem. He thinks about the horror, "I have a disease." He perceives the night and sleep as a disease. He is always expecting unpleasantness. And you know such a self-fulfilling prophecy. If you go to bed with the feeling that you will be sick and not sleep there, so it will be. And in fact, this negative attitude of a person further exacerbates insomnia. In general, if a healthy person has something happened and he had a bad night's sleep, what does he think about the next night? Yes, I'll sleep well as I've built up a sleep deficit. And what does a person with chronic insomnia think if he has an even worse night today? He believes the upcoming night will be a complete disaster. He becomes increasingly restless, agitated, and anxious, which worsens the situation, creating a vicious cycle. And then the next situation starts. The person begins to exhibit what is called maladaptive behavior. If I'm lacking sleep, I should go to bed earlier and rise later, especially people in such flexible professions who can increase their time in bed. And a person starts to lie in bed for 10, 11 hours instead of 7, 8 trying to fall asleep. He thinks he should try to get his own good. But the longer a person lies in bed, the more this sleep spreads out to 12 hours and becomes even lighter. More awakenings, more arousals, and the person develops such a phenomenon of sleep perception disorder that he thinks he hardly sleeps at all. In truth, he sleeps but has many wake-ups, all of which he recalls. Someone states, I lie in bed for 12 hours, only sleep 2-3 hours, and yet can't nap during the day. Generally, doctor, I might soon die from insomnia. So sometimes it comes to this, and it's a really sad situation when such a hypochondriac syndrome forms. That is, a person really thinks that he has the most serious disease, which can cause him some health problems. He can die from this. Consider this analogy. How might someone feel who believes they have brain cancer? He believes he's nearing death and is drafting a will, only to be told he doesn't have brain cancer. He says, no, I'm definitely going to die soon. And that's what happens with insomnia. And as you understand, this insomnia, it's not some somatic or psychiatric reasons. It's conditioned negative reflexes, negative thinking, maladaptive behavior. And this is so-called Pavlovian conditioned reflex insomnia. Once again, this is more than half of all chronic insomnias. So if we prescribe medication in this situation, what do? We will get another reflex of fear of not being able to sleep without a pill. That is, we actually start treating a person, forming another conditioned reflex, which will underpin insomnia. And long-term use of drugs is physical dependence, and long-term use of drugs can further impair sleep. And it turns out to be a dull situation. We cancel the drugs phenomenon of cancellation. A person thinks, oh, I won't sleep, and doesn't fall asleep. And in fact, we can't even cancel the drugs now. And now I want to talk about the most effective method of treating such chronic conditional reflex insomnia. This is cognitive behavioral therapy for insomnia. I implement this program, and by the way, if you suffer from chronic insomnia, you can sign up for an appointment with me, and I will try to help you effectively. I cure the majority of patients, well over 70% of patients with chronic insomnia, in a month and a half. In the description to this video, there is information on how to sign up for an appointment with me, as well as a description of the program itself. Please contact, I can help you effectively. And a few words actually about what the program is. If we have ingrained conditional negative reflexes, fear of falling asleep, negative thinking, and so on, then we need to apply techniques that allow us to remove these negative reflexes. And to tell a person, just relax and fall asleep, it's impossible. They say, don't think about a pink elephant. Well, will a person stop thinking about it? No, he will start thinking about it even more. But the most, strangely enough, effective method of improving a person's sleep is the treatment of insomnia by limiting sleep and time spent in bed. That is, a person is lying in an attempt to fall asleep. We discovered, for instance, he had sufficient 8 hours. We reduced the time spent in bed to 6. Certain calculations exist, and this regime is individually chosen for each person. And we say that, dear friend, you should not lie in bed for more than 6 hours. And a person begins to accumulate a real sleep deficit. Generally, someone stated that previously they couldn't sleep at night due to insomnia, nor could they sleep during the day. I tried, but nothing worked. And when we sharply limit his time in bed, a person really starts to get sleep deprived, and he starts to feel sleepy. He says, I remember this one 10 years ago, I only experienced such sleepiness. And if by evening pronounced sleepiness develops from real sleep deprivation, then even if a person thinks that he will not fall asleep, his negative reflexes are triggered. The growth of sleepiness in the end overcomes this reflex, and the person falls asleep, even with the thought that he might not fall asleep. And enough 15-20 times to fall asleep without fear, a positive reflex is formed. The bed is sleep. And I will say, It's just fantastic that literally in 2-3 weeks, a person who said that it's a nightmare, that the bed is a torture, he says, I fall asleep without a hitch, sleep these 6 hours, and I still don't have enough. Doctor, give me a little more. I say, well, okay, we had 15 minutes. He says, doctor, thank you. You just use different appetites on patients. Goodness, I made such a mistake. Gave the man another 15 minutes to lie in bed so he could sleep them off. Despite laying in bed for 12 hours, he claimed he didn't sleep a wink. Next, of course, we work with the man on his lifestyle because we remove coffee from his diet, provide regular physical exercise, normalize his routine, and ensure informational detox. That is, we are essentially teaching the man healthy habits anew, which ensure good sleep. You know, there's a good saying that you need to guard your honor from your youth. So, in order to sleep well in the evening, you need to think about it in the morning. Someone has that, classic 3-chair syndrome. The car seat, the work chair, the chair at home in front of the TV. And he watches the news nonstop, literally all night, and worries. And he has no physical exertion and no burning of stress hormones at all. This naturally leads to insomnia. And we also normalize the lifestyle, which greatly contributes to the person starting to sleep normally. And another extremely important and large block, these are the so-called stress relief techniques. When we teach a person to cope with stress more easily, it's easier for them to endure it, to get out of a state of stress. Such a one, probably the latest, not so much fashionable, but effective method, it is called deliberate calm or premeditated tranquility. When we teach a person to periodically exit a state of psychological stress using a certain system, the person then much more easily copes with stress overall. Sometimes a person may ask, I have such a stressful job, should I quit? But how can I then provide for my family? The use of these relaxation techniques allows a person to keep both their job and their social life. He becomes much more psychologically stable and handles stress more easily. And over the course of 6 weeks, working with a person on this program, if the person is willing and ready, I can cure most patients with chronic insomnia without medication. Moreover, if they are taking any medication, in most cases it allows them to stop or at least significantly reduce the dosage. And if before, I would say, patients with insomnia caused me, let's say, unrest, because even their treatment often did not lead to a positive result, now I love patients with insomnia because I cure most of them. It should be noted that the patient must have the right attitude, as this is a type of project. Ultimately, I do nothing for anyone. I teach him techniques, which he, when applied, deals with insomnia himself. But more than that, if a person has dealt with insomnia himself, then it's also a good counteractive technique. A person understands what steps to take, even if he has some bouts of insomnia. He understands 1, 2, 3, and that's it. Insomnia is gone, even without my help. And in this sense, I would like to underline once again, the program of cognitive behavioral therapy for chronic insomnia is an effective treatment method, which is confirmed in all clinical recommendations, American, European, Russian. And this is the first line of treatment for chronic insomnia. And if you had problems with insomnia, especially with chronic insomnia, what did you do? Were you treated with pills? Or maybe someone used cognitive behavioral therapy? Please describe in the comments your approaches to treating insomnia and whether it helped you. And were you able to completely get rid of insomnia, or did it only help temporarily? So if you have chronic insomnia, that is insomnia for more than 3 months, just prescribing medication is the wrong tactic. First, an examination needs to be conducted to clarify some, perhaps obvious, somatic reasons. I've already talked about them. Iron deficiency, yes, or sleep apnea, and get rid of them, and then we will cure insomnia. Or if we have eliminated all somatic causes and see that these are ingrained reflexes, apply cognitive behavioral therapy for insomnia. And only if it turns out to be ineffective or the person does not want to for some reasons, then we should resort to the last line of defense, to pharmacotherapy. That is, I believe that a person who suffers from insomnia should make some conclusions from this video and decide where he wants to go. You'll go straight ahead past this stone, then turn left. In general, go towards cognitive behavioral therapy, and that will be the right path. Subscribe to my channel. There are many videos about insomnia, about a healthy lifestyle, about how to normalize sleep in principle, or how to ensure sleep hygiene. And don't forget to click on the bell so you don't miss my latest interesting videos.